We've created this animation to illustrate mild hypertension and its management. On the x-axis, we have increasing systolic blood pressure, and this is broken into categories of hypertension using definitions from NICE. Here's how the population is distributed amongst those categories. Now, we'll make the y-axis represent health, and it's important to note that this is a conceptual diagram rather than a graph, so overall health is wellness rather than a specific measure such as all-cause mortality. Okay. It's a well-documented observation that increasing blood pressure is associated with decreased overall health, as represented by this red line. This association holds true for each category of hypertension, from mild to severe, and helps explain why high blood pressure became a target for intervention, with the belief that its reduction would improve our overall health. It's tempting to believe reducing blood pressure by any means would be a good thing. Let's look at the two main categories of intervention, lifestyle and drugs. If we think about lifestyle change, that's exercise, weight loss, smoking cessation, these will actually work to decrease blood pressure and increase health. And there's good evidence for this. Though bear in mind that exercise may act to improve health through more mechanisms than just decreasing blood pressure. If we now compare lifestyle change to drug treatment, we can see that medication which reduces blood pressure will also increase overall health, and this is the case for severe and moderate hypertension. If we treat patients with mild hypertension who are at low risk, we might presume that this will also increase health. But there's no actual evidence for this. We've just extrapolated from more severe cases. And then, if you bear in mind that all medication has downsides, it may be that drug treatment of mild hypertension in otherwise healthy people will actually worsen health in a way that lifestyle interventions are less likely to. And then, if you look at both graphs and realise the majority of people with hypertension have mild hypertension, the potential for overtreatment with medication becomes apparent. In the US, it's been estimated that the cost of medical treatment of mild hypertension annually is around $32 billion. That's approximately 1% of all US medical spending, and a full third of the amount spent on public health. These curves and interventions we've been drawing represent a static population. Public health interventions that improve lifestyle have the potential to actually create a brand new curve, one which represents improved blood pressure and improved health for everyone. This animation illustrates mild hypertension and its management, but it could also be used to describe many interventions where a surrogate outcome is used and where the evidence base is strong for more elevated levels and then extrapolated for less.